Hi, my name is Robin Peter, and I'm a second-year graduate student at the University of California, Berkeley. I work in the Department of Nuclear Engineering with a focus on medical physics. To that end, I collaborate actively with groups at UCSF, and my current project uses data from a collaboration with Fred Hutch Cancer Research Center in Washington. This project aims to develop tools necessary for understanding alpha particle therapy. Alpha particle therapy is a cancer treatment option that has the potential to help patients when chemotherapy and radiotherapy fail, for example, in highly metastatic cancers. In preliminary clinical trials, alpha particle therapy has seen some incredible success. There have been studies where failing prostate cancer patients have added years to their life, as in this image from a groundbreaking trial in Germany. The black spots on this PET scan represent metastatic cancers. Treatment with alpha particles drastically reduced the patient's PSA levels and improved their prognosis. In order to fully understand the effectiveness of this therapy and to use it safely, physicians need to know exactly how much dose these particles are delivering to tumors, and equally importantly, how much unwanted toxicity might be transmitted to healthy organs. These effects are not well understood for alpha particles because they're harder to detect than conventionally used treatment radiation. In my poster, I demonstrate one device, the iCAD camera, that can be used in preclinical research to image alpha particles and their dose. The system is capable of tracking individual particles from a biopsy or prepared tissue specimen, and it translates that into a 2D radioactivity image. To maximize the detection efficiency, remember, alpha particles can be difficult to detect. Specimens must be very thin, so a given biopsy has to be cut into a lot of pieces. My work uses image processing to match these pieces up with each other and enable dose analysis. From there, we can use particle simulation results to estimate the energy, and therefore the dose, that each of those alpha particles contributes to the tissues around it. In the end, we get images showing dose rate in those tissues. These dose rate images are a launchpad for many other data analyses that are important to the field of dosimetry, to researchers, and to physicians. In my poster, I demonstrate the feasibility of a few of these. For example, can we match up our images with stained cell microscope slides to investigate which cell types are receiving more dose, and are those cells the ones we wanted to treat in the first place? Another component of my work is to use image processing to improve this dosimetry pipeline. Maybe it's possible to do this whole analysis with only one single slice of tissue instead of having to spend literal days collecting data from 20 slices for a single data point. Or perhaps we can develop script-based methods to speed up the alignment procedure so that it's easy for non-experts to get this data out from the images. Improvements like these can help encourage the sort of dose verification and alpha therapy research that's needed for its transition to the clinic. Thank you, and I hope to see you at the symposium.